Okay, so I'm going to go over this particular patient. She's actually a 12-year-old girl, and she's had some really interesting conditions over the last few years. When I first started seeing her, her mom was extremely worried. Her cardiologist was worried that she could only literally sit on her head to be comfortable, meaning she would have to actually flip her body over on the couch, and that was the only way she could be comfortable. She had trouble in school. She missed a lot of days in school because she was sick a lot. She had some other, symptoms that were really heart related, and I know she was seeing a cardiologist during that time period as well. Her mom brought her in as almost like a last resort, like, we were it. If we couldn't help her, then there was nothing that could be done. And occasionally this happens. And that was 2 years ago. So since then, she's been on a nutritional program with us and it's done significantly better. She misses school a lot. She still misses on occasion, but it's usually due to headaches or something of that nature. It's not necessarily due to the fact that she has these, other dizziness issues and very uncomfortable, physically uncomfortable, and her legs are uncomfortable, and literally having to sit on her head. I mean, this was this case. So she did very well on a nutritional program. It took us probably about 3 months or so to get her stabilized, and she's been relatively stable since. And I was talking to her mom about the heart sound recorder, and just to see what her heart looked like. And I'm just going to kind of show you the graphs here. This is her first visit. So this was 11/9, and then this is the second one, which was 11/16. So what we're looking at, and one of the things I thought was really interesting, even though she's doing better, there's still some real issues here. You can see that the first and second heart sound, so the first heart sound should be louder than the second heart sound. You can see in a number of these it's not. It's the opposite way. And then some of them it's fine. So there's some difference there. On top of that, when you're looking at the difference in the length of the contraction of the muscle tissue and how long it should be relaxed, you can see here that this is 0.17 seconds, and this should be twice that length. So the heart should rest about 2/3 of the time. And even if we take it from here, we're looking at 2.3, we're looking at 2.5. So it's definitely not twice as long, right? So it's obvious. And this is the only one that actually was fine. And if you go through the rest of her graph, you can see that there's very few where you have that much separation. And when you really look into the aortic area and the pulmonic area, these particular areas, I mean, it is just fluttering away. Her heart's just not resting, which would make sense as to why she's having this trouble. And I'm sure it was, if this graph was done 3 years ago, when she first started coming here, it would definitely be different. It would definitely probably be worse than what this is, because we already, like I said, we already had our nutritional program for a while and gotten very, very, very good results with that alone. So in the second graph here, you can see, again, there's a little bit more separation. And this is after just a week, because I gave her a particular supplement to see if we can calm it down, to kind of get the beat calmed down so that it's not just fluttering, like just. And I think her heart rate at the time was 102. Just sitting, resting heart rate was 102. So you can see on the second graph, still a lot of trouble, but it's smoothing out a little bit compared to the first one. And you can kind of see that. And when I pulled up the pulmonic, you saw a little bit of fluctuation here. That was body movement. That wasn't actually a beat or anything like that. She just kind of was shifting around a little when I started recording it. And then you can kind of see there. But you even see roughening through here, roughening through here, roughening through here. So that has to be sorted out as well. So we're trying to use this just as a tool to just see if there's anything else we can do that'll kind of help her condition progress. And when I talked to her this past week, she said she was doing a lot better. And there's 0.15. So let's see what the difference is here. Let's see if that's much of a difference. And 0.25. So that's a little bit better. Yeah, let's just check this one too, just to see what the difference is here. This is 0.16. So this should really be about 0.32 before the next beat hits. It's about where it ends. 0.25. So that's a little better on this one here. And again, I'm not saying that this is perfect or we got everything that she's going to need to help this. So we'll kind of follow this case for the next couple months, because this is not going to be a short one. This is 6.2. Like, this beat looks pretty good when you're going through that. So you can see that that's 0.3. So that one's actually pretty good there. So it's not all of them, and it is kind of shifting around a little bit. So it's definitely something that we're going to continue working with on this particular case. But it was just interesting. I thought, you know, I'd like to present this one so you guys kind of see what we're looking at here. And yeah, so definitely an interesting case history. So anyway, so I want you guys to know about it, and I'm going to keep monitoring her for the next few weeks, and possibly, I'm not really sure how long this one's going to take to really sort out, because it's already been a few years and we're still working with her. On top of that, one of the other conditions she has is an inability to gain weight. And if your heart, you know, if your metabolism is this high, where your heart is beating all the time, you have difficulty gaining weight. There should be a rest period in there. And some of them you have it, some of them you don't. But overall, even on the second graph, you know, I personally think these look better than the first graph. And that's just my own opinion here, because I've been looking at these for a while now. And you can kind of see how that's just, there's no rest there. There's just no rest. Even through the beat itself, there's no rest. And when you look at the second graph, you see that it's at least resting a little bit in between. You can see there's a little bit more of a separation here. And you can even see a nice, good heart flutter right through there. So the heart contracted and just kind of vibrated. But you can see a little bit improvement over the two graphs. So that's good. That's good in just a week's time. And again, it would have been really interesting to have this stuff much earlier to see what all these things would look like, you know, prior to us actually even starting a program with her to determine, like, you know, what was happening in this particular case. So anyway, so if you guys are interested and want to have yourself checked out or your kids checked out, one of the things is, you know, this is no different in kids or adults. It's this, you're basically looking at nutritional deficiencies through heart sounds. That's actually what we're doing with this. And doesn't mean kids aren't nutritionally deficient, because they are. I don't know if anybody had Halloween recently, a couple weeks ago, right? You know, how much candy did they eat? I mean, that's not nutritional stuff, right? Or junk food and things like that. So they can be just as deficient as adults, and it's always a good idea to really handle them before they become adults, so that, you know, they actually really have a good chance of staying healthy their entire lives. And like I said, this is just a real simple tool to see what nutritional deficiencies a person might be running into, and it doesn't matter what age it is. We have her. She's 12 years old now. She started with us when she was 10, or actually 9. And, you know, it's been an interesting road for her. And her mom is very happy with her progress, obviously. She hasn't had to sit on her head in over a year now, which is, you know, pretty remarkable. Because, you know, you don't think about it, but that's suffering. I don't know what else to say. That poor kid was suffering. And now she's not, and she's leading a relatively normal life, and she doesn't, you know, she doesn't have to miss school, and she's doing well in school. And I mean, these are important factors. These are things that are very important, and I personally feel, you know, the necessity to help really the younger generation out. Not that I don't like helping the older generation out, but you know, really the kids really need help. And you know, a lot of times parents don't know what to do because they're being seen, and pediatricians say they're fine and everything's okay, or they can't necessarily find the issues with some of them. But obviously, you know, if a child is nutritionally deficient, if they have gut issues, you know, where they're not digesting food correctly, they have metabolism issues. I mean, they have all the same issues adults do. They manifest differently. They show up differently in kids than what they would in adults. They should be checked. And you know, not necessarily this case, but you know, you've heard of people who, young kids, 16, 17 years old, 15 years old, playing sports and having heart failure. You've heard of those particular things. Well, that's an indication that that child's heart isn't resting, and that's really what you're looking at, is that child's heart resting. If you have something, I mean, obviously it would be worse than this one is, but there were a couple sections in there where if you have this kind of fluttering going on and that's not necessarily stopping, and these are shortened in here where the heart isn't, you know, the heart's got that 0.17, you know, tenths of a second there where it's actually beating, and then it only has the same amount here. The heart never has a chance to truly rest in between the beats. And so it ages faster because you figure you only have a number of heartbeats to use in an entire lifetime. So if you look at it from that viewpoint, it actually ages faster. So the kids can actually have cardiovascular issues. And it doesn't mean they're not picked up or should be picked up or whatever it is. It's not kind of what I'm getting at on this. It's just they have nutritional deficiencies. And then you add in sugar diets, high carb diets to their to their already weakened state, and it's a perfect storm. And the kid's out there really aggressively playing, and his heart just quits. I mean, that's why you have defibrillators on the side of football fields and basketball courts and hockey rinks. I mean, you have those things because this is actually a real issue for all kids, all adults, even adults, really. So these things should just be checked every now and then, something like this being done. This isn't an EKG. Some of my patients said, well, you're checking the electrical stim, and this is not what we're looking at. We're looking just at the heart sound itself. So we're just looking at the vibration in the chest wall. That's all we're looking at. And by using these particular tests, if you know how to interpret them, you have an idea of what kind of nutritional deficiencies a person has. You pull them off sugar, you know, you maybe modify their diet a bit, and these things change. The heart gets stronger. And it's not just the heart getting stronger, but the entire body gets stronger. So anyway, so that's all I have to do on this particular one. And if you're interested, you can give us a call, 716-754-9039. And always remember, a well-nourished body is a healthy body.